1. Which principle of adult learning emphasizes the importance of relating new knowledge to prior experiences? A. Constructivism. B. Andragogy. C. Behaviorism. D. Cognitivism. 2. When evaluating the effectiveness of a CFRN training program, which method best measures long-term retention? A. End-of-course quiz. B. Post-flight debrief. C. Delayed post-test. D. Attendance record. 3. A certified flight-registered nurse, mentoring a new nurse, uses reflective questioning to encourage self-analysis. This demonstrates A. Directive teaching. B. Experiential learning. C. Didactic instruction. D. Task-oriented coaching. 4. Which evaluation model emphasizes the measurement of outcomes in terms of impact on patient safety and care quality? A. Bloom's taxonomy. B. Kirkpatrick's model. C. Addy model. D. Maslow's hierarchy. 5. When developing curriculum for CFRN candidates, aligning objectives with measurable outcomes represents A. Construct validity. B. Objective standardization. C. Instructional alignment. D. Competency mapping. 6. Which adult learning principle is best applied when teaching CFRN trainees in high-stress environments? A. Problem-centered orientation. B. Memorization techniques. C. Teacher-centered focus. D. Passive learning. 7. The most effective tool for evaluating psychomotor skills during CFRN training. A. Written exam. B. Simulation assessment. C. Group discussion. D. Case study. 8. A CFRN mentor providing constructive feedback without undermining confidence is applying A. Formative evaluation. B. Summative grading. C. Negative reinforcement. D. Punitive feedback. 9. Which communication strategy ensures safety-critical instructions are understood in flight scenarios? A. Closed-loop communication. B. Passive listening. C. Open-ended feedback. D. Nonverbal cues only. 10. During CFRN curriculum design, which approach ensures compliance with FAA and nursing regulations? A. Evidence-based curriculum mapping. B. Anecdotal teaching methods. C. Instructor intuition. D. Peer preference alignment. 11. Which principle of mentoring emphasizes modeling professional behavior for new CFRNs? A. Role modeling. B. Constructivist learning. C. Competency scaffolding. D. Behavioral conditioning. 12. A key regulatory compliance element in CFRN training is A. HIPAA adherence. B. Financial reporting. C. Aviation fuel monitoring. D. Personal preference surveys. 13. Which instructional strategy best supports kinesthetic learners during flight nursing training? A. Peer-reviewed journal reading. B. Case study analysis. C. Simulation practice. D. PowerPoint lecture. 14. Which evaluation tool is most valid for determining a CFRN trainee's ability to handle in-flight emergencies? A. Oral exam. B. Flight simulation scenario. C. Multiple choice test. D. Essay examination. 15. The process of aligning CFRN continuing education with state board requirements is known as A. Accreditation compliance. B. Knowledge dissemination. C. Summative assessment. D. Competency substitution. 16. A nurse educator uses SMART objectives in a CFRN training program. What does the A represent? A. Accurate. B. Achievable. C. Applied. D. Analytical. 17. Which communication technique ensures clarity in high-noise flight environments? A. Written reports. B. Closed-loop confirmation. C. Open-ended dialogue. D. Passive observation. 18. Which adult learning theory emphasizes that motivation increases when learners see immediate application of skills? A. Behaviorism. B. Humanism. C. Andragogy. D. Cognitive load theory. 19. When CFRN mentors guide new staff through reflection after each mission, they are applying and contractors. A. Debriefing as a learning tool. B. Summative testing. C. Didactic lecturing. D. Memorization drills. 20. Which regulatory body primarily sets standards relevant to CFRN practice? A. National League for Nursing. B. Federal Aviation Administration. C. U.S. Department of Agriculture. D. Environmental Protection Agency. 21. When training adult CFRNs, self-directed learning modules best support which principle? A. Autonomy. B. Dependence. C. Rote memorization. D. Teacher dominance. 22. Which tool best evaluates communication effectiveness during simulated patient handoffs? A. Observation checklist. B. True-false exam. C. Written report. D. Random quiz. 23. The primary goal of formative assessment in CFRN training is to A. Assign final grades. B. Measure long-term outcomes. C. Provide ongoing feedback. D. Eliminate underperformers. 24. Which strategy enhances retention of CFRN protocols under stress? A. High-fidelity simulation. B. Silent reading. C. Instructor lecture. D. Peer observation only. 25. Which mentoring style is most effective when onboarding a new CFRN with minimal flight experience? A. Directive coaching. B. Autocratic leadership. C. Independent study only. D. Passive observation. 26. Which evaluation method measures both knowledge and skill performance in CFRN practice? A. Multiple choice exam. B. Objective structured clinical examination. OSCE. C. Short essay test. D. Peer review survey. 27. In adult learning, the principle of relevance refers to A. Content applicable to learners' work. B. Instructor authority only. C. Standardized memorization. D. Generic knowledge transfer. 28. Which communication barrier is most common in helicopter transport scenarios? A. Lack of vocabulary. B. Noise interference. C. Cultural diversity. D. Written misunderstandings. 29. Which type of curriculum design focuses on building competencies required by CFRN certification boards? A. Outcome-based curriculum. B. Teacher-centered curriculum. C. Spiral curriculum only. D. Rote-focused curriculum. 30. Which regulatory compliance factor must be included in patient care documentation by CFRNs? A. HIPAA confidentiality. B. Fuel expenditure. C. Aircraft inspection logs. D. Crew scheduling. 31. When evaluating CFRN student learning, which method ensures validity? A. Aligning test items with learning objectives. B. Using only instructor opinion. C. Prioritizing convenience. D. Minimizing testing variety. 32. Which type of mentoring fosters mutual growth for both mentor and mentee? A. Reciprocal mentoring. B. Top-down coaching. C. Passive oversight. D. Authoritarian guidance. 33. Which adult learning principle explains why CFRNs prefer solving real-life case studies? A. Experiential orientation. B. Memorization theory. C. Instructor-centered teaching. D. Abstract theorizing. 34. Which evaluation method best measures effective learning outcomes for CFRNs? A. Attitude surveys. B. Written math test. C. Multiple choice exam. D. Lab skills demonstration. 35. In CFRN training, regulatory compliance ensures that A. Aviation and patient safety standards are met. B. Personal teaching styles dominate. C. Trainees skip redundant modules. D. Financial savings are maximized. 36. Which is the most effective tool for fostering critical thinking in CFRN trainees? A. Problem-based learning. B. PowerPoint lectures. C. Passive observation. D. Instructor-led memorization. 37. Which mentoring practice builds long-term confidence in CFRN novices? A. Progressive responsibility assignment. B. Immediate independent deployment. C. Restricting feedback. D. Withholding evaluations. 38. Which regulatory framework applies to safe transport of blood products by CFRNs? A. FDA guidelines. B. EPA standards. C. FAA noise regulations. D. OSHA workplace safety. 39. Which strategy best integrates evaluation into ongoing CFRN training? A. Continuous performance assessment. B. Final exam only. C. Peer popularity scoring. D. Attendance verification. 40. Which element is essential in developing a CFRN training module on in-flight ventilator management? A. Competency-based objectives. B. Instructor preference. C. Memorization of manuals only. D. Learner independence. 41. When CFRN instructors align teaching with state nursing boards, they are ensuring A. Regulatory compliance. B. Instructor autonomy. C. Learning diversity only. D. Simplification. 42. Which evaluation method ensures fairness in CFRN competency testing? A. Standardized rubrics. B. Instructor bias. C. Oral questioning only. D. Peer popularity votes. 43. Which communication practice improves patient handoff accuracy? A. SBAR framework. B. General assumptions. C. Passive listening. D. Narrative storytelling. 44. Which mentoring model is most suitable for developing leadership in CFRNs? A. Transformational mentoring. B. Autocratic supervision. C. Passive monitoring. D. Directive-only coaching.